Good afternoon, everyone. Today we all are gathered virtually to attend webinar on breastfeeding and advantages. So now let me introduce our speakers, Dr. Bijal Saraya ma'am. She is a completed MBBS in Sivsa Medical College, Surendranagar, Saurashtra University, and Diploma of National Board Pediatrics, Kasiba Children Hospital, Karelibag in Vadodara, also completed in diploma courses and diploma in child health, Institute of Medical Science, Rajiv Gandhi University of the Health Science at Bangalore. She has also completed diploma course in child health, and she is currently working as a consultant and pediatrician at Hope Kids Clinic, Vadodara, and also attached to Kasiba Gordondas Hospital, Vadodara, and member of SRO Foundation, Kalali at Vadodara. Okay, so ma'am, welcome to ma'am,
Thank you.
and I welcome you, ma'am, behalf of Parul University and Parul Institute of Nursing. So I request you to start your presentation. So, ma'am, please start your presentation now.
Okay. Thank you. See, we had taken this topic because first week of August is presented as
Sir, loudly speak. Ma'am?
yeah.
Yes. Your voice is not completely clear. So loud your voice.
We
Hello?
we present first we celebrate breastfeeding week of first week of August as breastfeeding week. So only I have chosen this topic. And as such, all the mothers whosoever has delivered need some or other help during the breastfeeding. So I have taken. As a nursing student, all of us are supposed to assist all the mothers during the postnatal period. So I have taken this topic. In our hospital, Kashiba, we promote breastfeeding and it is a baby friendly hospital initiative type of hospital. So let's start. Madam, can you just change the slide?
Okay.
Breastfeeding is a baby's first vaccine. So nowadays, because of this corona pandemic, everybody is behind corona vaccine. So everybody must know what is vaccination. So what we say as a pediatrician is breastfeeding acts as first vaccine of the baby and it prevents so many infections. Next slide, please. So what are the breastfeeding types? First one is colostrum, second is transitional milk, and third is mature milk. Next slide, please. The colostrum, this is a small amount for immature digestive system. It basically paints the digestive system and it has very low fat to easy digestion. It contains mother's antibodies which boost infant's immune system. It also acts as a laxative to ease the passage of meconium. So mostly what happens is when the mother is either delivered normally or had undergone cesarean section, most of the mother they are taught or they are told by elders to discard the first feed which is known as colostrum. But we as a medical person and healthcare worker should promote the first feeding of the baby which is known as colostrum because it promotes the health system and it has so many noted advantages. Next slide, please. So, what are the exact benefits that we'll discuss later? So, what is the second terminology which is known as transient milk? So, this transient milk, which is the colostrum, is secreted during first 24 hours. This transient milk will be secreted from birth up to 2 weeks. So, this milk is also yellowish in appearance and its amount increases quickly as infant hungers and digestive system matures. So mother's milk making changes from endocrine to autocrine system means in first few days the total milk making would be dependent on our endocrine thing like our hormones. After that it becomes autocrine means whatever baby needs that much milk would be produced. And after 2 weeks, the milk would be matured. It would be supply and dependent thing. Like we already know, supply and demand means whatever amount of milk baby requires, or whatever demand baby does, that much supply will happen. So, and it would have properties of foremilk and hindmilk. Now, what is foremilk and hindmilk? Fore is the milk which is secreted before, and hindmilk is the secreted which is secreted behind. So, when the baby starts sucking, it would suck foremilk. Foremilk will have more water content, so baby's thirst would be satisfied, and hindmilk would be having more calorie content. So, the baby's hunger would be satisfied. So we advise all the mothers to give make the breast totally empty and give formilk as well as hind milk, because initial one is important to make the baby's thirst to be satisfied, and last one is important in calories. So we should advise all the mothers to give complete 10 minutes breastfeeding, 10 to 20 minutes breastfeeding from each breast. Next slide, please. What are the advantages to the babies because of breastfeeding? So, it lowers the risk of diarrhea. If you all must be aware that less than infant mortality rate is highest, almost very high in India. So the main causes for the mortality are respiratory and diarrheal infections. So those both of those infections, they are when the baby is breastfed, chances of diarrhea and other infections are very less, because we don't have to clean the bottle, and all the hassles are gone. So it lowers the chances of diarrhea and other infections like ear infection, respiratory, meningitis, and urinary tract. Then, whenever the babies are bottle fed, it has some lacking of because of lacking of some enzymes. The baby tends to get constipation, but it doesn't happen with breastfeeding. Then six, it is known as sudden infant death syndrome. It is a very dangerous entity. In this kind of situation, the baby dies without giving any hint why the baby died. So there are lots of studies, and they say that if the baby is breastfed, then the sudden infant death syndrome chances are very less. Then allergic disorders. So if the baby is breastfed, then the allergic skin reactions, then asthma, all those diseases will be less compared to the babies which are bottle fed. Then chronic digestive diseases like celiac disease, and all those diseases are also less when the babies are breastfed. Then juvenile onset diabetes. The chances of juvenile onset diabetes are very less when the babies are breastfed. Then the trials are suggestive of that acute leukemia and adult obesity is also very less. Next slide, please. So, what are the immune advantages? So, it contains certain antimicrobial agents, certain anti-inflammatory agent, and immunomodulatory agents. Basically, it contains lactoferritin, which inhibits the gut bacteria, so diarrhea is less. It contains vitamin A in very high amounts, so that other whatever organisms are in the digestive tracts, those organisms are killed. Then it modulates the immune system of the baby, so that baby doesn't get much infections. Next slide, please. Then the breast milk is very baby specific. Baby specific means, I meant to say, is if the baby is preterm, then the milk is accordingly modified, and if the baby is term, milk is modified. If the baby is fat, the milk is modified. If the baby is lean, the milk is modified. So if we say, it is always modified according to baby's needs. Whereas whenever we give cow's milk or formula milk, we cannot modify anything. Whatever is there, it is there. It is not like that in breastfeeding. So specifically for preterm babies, if we give breast milk, it reduces necrotizing enterocolitis. It reduces chances of retinopathy of prematurity, which is a very dangerous condition, and it can we can lose baby's sight also. It decreases infection rates, and it is very good tolerating. The tolerance of the feed is very good breastfeeding, and the intelligent quotients are very high. Then, when baby is taking breastfeeding, the intelligence quotients are very high because it contains long chain polyunsaturated fatty acid, which helps the infant's brain development. They are normally provided by mother in the late pregnancy, but preterms, anyways, we know that they have not gone to late pregnancy, so they are early born. So when they are given the breast milk, they get the added advantages of this PUFA. It is known as PUFA, polyunsaturated fatty acids. Um, so baby, this is very baby specific milk, and all the baby terms should be offered only breast milk until unless there is any contraindication. Next slide, please. So, what are the advantages to the mother because of breastfeeding? So, mothers will have less postpartum bleeding because of oxytocin release. The uterus will contract and the bleeding would be less. Then there would be more rapid involution of the uterus, means the mother whose tummy is almost out, and it will come down very fast if the baby is breastfed. Then weight loss. So whatever fat we have accumulated, that fat will be lost when the baby is breastfed. Then decreased premenopausal breast cancer rates. So it decreases breast cancer rates, and it decreases ovarian cancer rates in the mother. Then lactational amenorrhea. Lactational amenorrhea means till it is shown that whenever we are breastfeeding our kids, when mother is breastfeeding the kids, till that time she will not get her period. So that indirectly will act as a contraception. But if mother wants to take any contraception, then she should use only progesterone, only contraceptive, combined contraceptives like OCPs, which we get, Malady and all. They will dry up the milk. Next slide. So, what are the benefits to the parents and the society? Okay, so it saves money, time, and babies will love it. So, money, how does the breastfeed saves money? So you think of bottle feeding. So we have to buy bottle, we have to buy milk, we have to buy powder, we have to buy water, we have to boil it. In the middle of the night, mother has to get up, boil the milk, and then put in the bottle, then make it cold, at least lukewarm for the babies to drink. So much hassle she has to do in the middle of the night and during the daytime also. So if we see that hassles will be less in the breastfeeding, second would be the money. The money which is used in buying milk will be too much if we calculate. So breastfeeding is absolutely free. So that two ways it saves money. Then time. Time, as I've already mentioned, that we have to boil it and then cool it and then make it lukewarm for the babies to drink, then put in the bottle, then clean the bottle, and if we are missing anything out of it, then babies will become sick, and then we have to spend money in the hospital. So it saves money, it saves time, and for society it makes the diseases chances very less, and babies would love it. Means babies are very much satisfied when they are at breast. They feel secure, they feel bonded to the mothers, and they are more intelligent. Next slide, please. Now, something into the lactational anatomy and physiology. So, during the pregnancy and lactation, it indicates that mammary glands are becoming functional. Breast size before pregnancy never determines the amount of milk. Breast size will never determine the amount of milk the mother will produce. Next slide, please. Now see, this is an inactive breast. Okay, so this is a when the mother is not pregnant, or at that time the breast will be very small, and the lactiferous glands and the lactiferous duct and the nipple, everything will be very small. As soon as she gets pregnant, the dopamine would be released. It will go to hypothalamus. Hypothalamus will stimulate pituitary, and prolactin will be released. That is responsible for breast differentiation, duct proliferation and branching, glandular tissue development, and milk protein synthesis. So lactogenic enzyme synthesis, mammary gland development and milk production. Next slide, please. So this picture shows inactive breast and lactating breast. As we all can see that the amount of lactiferous ducts seen in inactive breast is very small. But when the mother is lactating, that time the lobules are enlarged, the ducts are enlarged, the sinus is enlarged, and the breast size is from smaller to bigger. And in the alveolar, you can see the milk droplets also, and the milk lipids also, how it is secreted. So this is basically everything is caused by prolactin during the pregnancy, and post pregnancy prolactin and oxidation will come into the place. Next slide, please. So hormones during the pregnancy. So hormones are, as we all know, estrogen, progesterone, and prolactin only will be secreted during the pregnancy. So estrogen will stimulate the ductile system to grow. Then estrogen level drops after birth. So after birth, the ductile system will not grow. Then progesterone, it increases the size of ileoli and lobes. From that, milk production will be initiated. Then prolactin contributes to increase breast size during the pregnancy. Next slide, please. So we can see this. When the mother is feeding the child, she will feel positive, and if she is feeling very positive and happy about it, that will produce a positive feedback, and then the milk prolactin will be produced, which causes the milk production, and oxytocin will also be produced, which causes milk ejection. I'll explain you in the next slide. So what happens is alveoli secrete the milk and contract when stimulated. So oxytocin, it basically stimulates the milk secretions. Means though the prolactin makes the milk, the oxytocin is required to stimulate the milk secretion. So it is known as letdown or milk ejection reflex. Sometimes what happens that when the mother is feeding the baby at one breast, the other breast also will start secreting because of oxytocin. Next slide, please. Next slide. So what happens is when the baby latches on, means when the baby takes the nipple in the mouth and starts sucking, it causes oxytocin release, which releases the milk, and then infant empties the breast. Production increases and milk production occurs. Can you just go back one slide? So hormones during the breastfeeding. So I already explained that prolactin levels will rise with the nipple stimulation. Means some mothers whose babies are not latching on the nipple, they will never be able to produce the milk. For milk production, the nipple stimulation is absolutely necessary. So as a nurse, we should explain to each and every mother that in the first few days when the milk production is less, they should latch the baby on the breast. Means they should make the baby suck on the breast. Otherwise, there won't be any milk production, because prolactin secretion will only happen with the nipple stimulation. So, when we are counseling any mother for breastfeeding, it is our duty to inform them that please make the baby latch on the nipple. Okay. So when the nipple is stimulated, alveolar cells started making milk in response to when the baby is sucking, and then the oxytocin will reduce. It will cause the alveoli to squeeze the newly produced milk into the duct system. From there, the baby will start sucking the milk. Next slide. One more. Next slide, please. So, last slide. Last slide. So what are the causes of breastfeeding barriers? So basically, when the infants are deprived from the breastfeeding, they leave many mothers disappointed. Means now in the modern society, all of us are reading so much about breastfeeding, so we are so much stimulated that I will breastfeed my baby, otherwise my babies are not going to be very intelligent, this, that. Okay, so mothers are very anxious. So anxiety will reduce the breast milk and production. So that whenever infants are latching at the breast, the milk production is less. So that will cause a vicious cycle and it may cause breastfeeding failure. We have to explain to each and every mother that it is natural process, but many mothers need a lots of help. And then the society, it will tell, oh, मुझे तो आ गया था, आपको कैसे नहीं आ रहा है? Mothers, mother, whatever the mother is breastfeeding, their mothers and grandmothers and sister-in-laws and lots of other people will come and help. In that help, they mostly will be damaging the mother's mindset that she cannot breastfeed like that. Oh, it's okay, मैंने तो अपने बच्चे को गाय का दूध पिला के बड़ा किया, तो सी वो डॉक्टर बना, उसमें क्या है, ऐसा कुछ नहीं होता है. अरे मैं इतना झंझट में कौन पड़ेगा ब्रेस्ट फीडिंग का, तुम पाउडर दे दो ना, कुछ नहीं होगा. ऐसे सब नहीं है. It is a natural process, and when God has given us a child, he will he the breastfeeding it is going to happen. It is a very natural process, but you might need a little help. So that help should be provided from us, from healthcare workers, specifically from you sisters. So this is a very important topic. Next slide, please. So what exactly is our role? How are we going to teach them that how to help them in breastfeeding the baby? So next slide, please. So first point is, next slide, please. Positions. So positions. So there are different positions. So this is the most important thing we can teach to any lactating mother. We should tell them to relax, okay, and tell them that whatever position the baby and mother is comfortable, that is the position to breastfeed. There is no specific position. Okay, if you are comfortable, your baby is comfortable, then in lying down also you can feed, you can make the baby feed. In sitting position also, in whatever position, in standing position also, we can, whatever position you like, and when you are comfortable. Don't listen to anybody, just listen to your heart and relax. Okay, but there are 5 specific positions which are described in the literature to help the mother. The first is cradle position. So cradle position. So in this position, make a angle at elbow. Make an angle at elbow. Okay, so this is the cradle position, and then support the baby's neck and buttocks. Don't support the head. Head is to be free folded. That's why there is no neck holding for 3 months, because for breastfeeding. So then try to put the baby's cheek in the mother's breast. So automatically, because of rooting reflex, the mouth will open. When the baby opens the mouth like a yawning, you put the areola and the nipple inside the baby's mouth. Okay, that is a cradle position. And the other hand is free, so you can hold the breast with your other hand also. Then cross cradle position. In cross cradle position, we held the baby's head from the other hand, and the same hand would be used for the same hand would be used for holding the baby's head. Okay. Then there is a football hold. This is specifically used for a very fussy baby who doesn't want to breastfeed, and mother having inverted nipple or flat nipple or any issue related to nipple. This is the best position. So in that, ask them to hold the baby like a football. Okay. And then put a pillow beside the baby, below the baby, and then hold the baby's head and put directly into the breastfeed. Make the other hand free so that you can position your breast accordingly. Then third would be side lying and sleeping position. In both the position, again, mothers should be very comfortable. Then only this happens. Next slide, please. Now, this is again very important. For most of the time, what happens is mothers try to give only nipple in the baby's mouth. Okay, so either they land up in having nipple crackings and sore nipple, and the milk production is less, or lump happens, or something and all happens. So this is the most important slide for all the healthcare workers again. So what happens is when the baby's chin touches the breast, the baby will open the mouth like yawning, first figure. And then you mother has to hold the breast in the hand, and along with areola and nipple, she has to put them in the baby's mouth. The nipple will face the baby's hard palate, and then the areola will be fully inside the mother baby's mouth, and then baby will start squeezing, so that whenever the milk is produced, it will go against the hard palate. It will never go directly in the baby, so baby doesn't cannot have gag reflex also. And the whole of the areola is inside. Nipple is a very sensitive part. So if baby keeps on do sucking only nipple, then nipple will get injured. But when the areola is a very tougher part, so even if baby is squeezing, nothing will happen. Next slide, please. So this is the thing. What is this shallow hatch? What is a shallow hatch does? I already explained. When the baby is this peda in the Gujarati we call it peda is as good as teeth, so they will squeeze the nipple out and it may cause the cracked nipples. Whenever we are putting more areola inside, areola is very tough, so it will never cause any cracked nipple or anything. So latching is very important, and I am telling you based on my experience, 80% of the mother will have nipple pain, 80%, and they'll be they'll be asking so many questions to most often to nursing staff that what happens, why it is happening, why, what is the position. So this is a very important slide for all of us. Next slide, please. Now lump. So what happens is first 2 days there is no milk production. It is very less. Third day suddenly the milk production will increase. Okay, and mother will not know the positioning or latching, or mother is having cesarean section. She is not able to get up from her and breastfeed, or the relatives are not very encouraging, and something is wrong, or we are not seeing properly healthcare workers. Something happened. So mother developed a lump. Why lump happens is because one of the duct is blocked, so it causes the milk to collect. Okay, so what we should do? Okay, so we should encourage. What happens most of the time, जिस साइड पे लंप हुआ है ना उस साइड पे मदर फीड नहीं करेंगी, वो मना कर दे कि मेरे को दर्द हो रहा है, मेरे को ये हो रहा है, मेरे को वो हो रहा है, तो मैं फीडिंग नहीं कराऊंगी बच्चे को. ठीक है, but we should tell them that this lump is because the baby is not feeding properly. Okay, so please make your baby feed on the same same breast wherever you are having the problem. You massage the lump, make sure that your baby is latching correctly. Use so many different breast positions. Use breast pump after each feeding to help the drain milk. Apply a warm, moist cloth to the area and see your doctor if lump persists for more than a week. Madam? Roma, madam?
Okay.
Feeding reflexes in the baby. So, what are the feeding reflexes? As we have already learned that when we make the baby's chin touch on the breast, the baby's mouth will widely open. It will open widely. So, that is a rooting reflex. When the areola and nipple is inside the mouth, then baby starts sucking. That's a sucking reflex. And when the milk is inside the mouth, the baby starts following. So this is a basically combination of three reflexes that for successfully breastfeeding a baby. So baby should have rooting reflex, sucking reflex, and swallowing reflex. So, and along with this, two things are very important. First is mother who learns to position the baby, and baby which learns to take the breast. Okay, so it might take some time, but we have to ensure them that it is going to happen, but it may take some little or more time. Next slide, please, ma'am. So, what are the breastfeeding barriers? So, first is breast pathology. Some mothers will have flat or inverted nipples. Then mothers will have breast reduction surgery. Means nowadays this plastic surgery trends are there. So some surgery might have happened. Then previous breast sepsis. In previous pregnancy, mother might have some problem and breast sepsis might be there. Then very sore nipples, means cracked nipples and bleeding and blisters and all those things are there. Then hormonal pathology. So failure of lactogenesis on hypothyroidism. I have already shown you, no, that hypothalamus and pituitary are very important in breastfeeding milk production. So if there is any problem there, then there won't be any milk production. Then overall health, some not in India but outside, so many mothers are having smoking histories, and in India, we all know anemia and poor nutrition and is very common. Nowadays, this depression is also very common. So these kind of mother also, when their overall health is not good, then they might not be able to breastfeed as good as other mothers. Psychosocial. So very restrictive feeding schedules. Mother will tell, I will feed my baby every 3 hourly only because it is written in the book. So it is not like that. It is a demand and supply thing. Whenever baby wants, you have to breastfeed. You keep at least 1 hour interval, but you cannot put it like before 3 hours. I will not be feeding the baby. Second is mother without support system. I already told. Nani, dadi, 100 people will come. 100 people will come, and they will not support the mother. Then, ma'am, can you go back to previous slide? Yeah. Then not rooming in with the baby. Rooming in is very important. So rooming in means whenever mother is sleeping, that same port baby also has to sleep. Baby cannot be separated. So rooming in is very important. Though in India this rooming is practiced very well, but if you go outside, means Saudi or other places, they have this cradles like baby nurseries. Their small beds are there, cradles. They are known as cradles. So baby should never be separated from mother for first month. They should be always rooming in. Then bottle supplementing when not medically required. Again, somebody had told that, oh, baby is crying excessively, give bottle. So we just without thinking give bottle. The nipple of that bottle is entirely different than nipple of ours. Okay, so baby will learn from sucking via that long and very easy type of nipple. But it doesn't happen with the breast. They have to suck well. Then only the milk will come. So they will become lazy, and that will be nipple confusion, and it will prevent the breastfeeding. So then mother will be previously breastfed infant who was not gaining very well, perinatal complication like PPH or anything or any parental infection. All these things also can reduce the breastfeeding. But we have to make sure that this doesn't happen, and mother is encouraged constantly for this breastfeeding thing. Next slide, please. So, how and when and where we can teach the mothers to breastfeed? So, first thing is we should ask them to hold the baby in their arms. We should give consistent information as we already had discussed. Means the unit, like I am working in OBG, I am taking care of all the OBG babies, okay? And you are, one of you or few of you are in my unit, okay? So, madam, previous slide, please. So we are just repeating different stories. Like I am telling you have to give this position. You are telling you have to give this position. Then mother will get confused. So whatever information, there should be a specific protocol written, and everybody should sing the same song. Nobody should differ. Okay. Then repeat the information in variety of ways. We should have a display unit, a small screen specifically to promote breastfeeding. Then there should be number of posters in a different languages for different languages for breastfeeding. Then mother should know what are the difficulties at first, and then we should constantly remind the mother that baby is also learning with her, and it will take some time, but baby will start learning. Okay. Then praise the mother's progress, help to build the confidence, and provide the discharge support. All these things should be definitely done. Then only we can successfully breastfeed the mother. Next slide, please. So how are we sure that the breastfeeding is going well and there is no problem? So we are very sure as a health worker that breastfeeding doesn't cause any problem. The mothers will have 100 doubts. So we should tell them that the weight loss, initial weight loss, should not be more than 7%. The weight should be normal to the birth weight in less than 2 weeks, and mother should have one mother should have 1 ounce per day weight gain for the first 3 months. I mean 30 gram per day. Okay. Then mother is very comfortable and satisfied. She doesn't have any pain, any lumps, any issues. Then if the baby is still losing the weight on the fourth day of life, we should do feeding evaluation. We should remember to feed the baby, maintain the milk supply, and continue the breastfeeding. So we should encourage the mothers to feed the baby, maintain the milk supply, as I've already explained, and continue breastfeeding. Next slide, please. So, what are the complications that can happen during the breastfeeding? Usually, nothing happens, but it is a very rare chance that these things may happen. So, babies could be premature, less than 38 weeks, difficulty in latching on. So, latching difficulty, I've already explained with picture that how are we overcome latching difficulties. Then, ineffective or unsustained sucklings. So, how are we going to be make sure that effective suckling happens? Then oral anatomical abnormalities. So some baby is having cleft leg, short frenulum, very small chin, and all these issues. So in those patients, specifically those patients, we should have a little help from dental people, and then we should provide some frenulum and all. Then multiples means twin pregnancy. So twin pregnancy, only one mother breastfeeding is difficult. So we can encourage them that you breastfeed both the babies. The milk production is going to increase if you feed babies continuously. Then the babies who are having jaundice, so they'll be shifted to neonatal ICUs for phototherapy, and the mother will be separated. So in that case, we can just ask the mother to be with the baby as much as possible in the nursery, and then breastfeed as much as possible. Then mother's cystic fibrosis. So cystic fibrosis is a very complicated infection, so that that those babies will never gain weight even if breastfed. Then any infection in the mother or baby. So again, baby and mother will be separated. Then cardiac disorder. Cardiac disorder babies are tend to not gain weight. Then neurological problems like Downs, hypertonia, any poor upgas, long labor. All these babies are not going to be very cooperative in breastfeeding. Then sleeping, non-demanding, passive temperament. Some babies are very lazy. They are lazy from beginning. They are very non-demanding. They are sleeping. So we have to wake those babies up and then make sure that they breastfeed. Then infant less than 5 lbs, like 2.5 kgs. So those infants, they are again going to be difficult. But if we encourage the mothers, then it might not be very difficult. Okay, next slide, please. I think we are done, right? Okay. So, how is the breastfeeding hospital discharge? So, we should support all the whenever we are discharging any mother from the breastfeeding. It is again our duty to see that mother is very confident at breastfeeding. She has a good support system after discharge, and she receives a follow-up advice after discharge. Now, upon discharge, we should give a written information that this is the thing. You can give some printouts to the mother and recommend the mother to keep breastfeeding recorded. Give the mother phone number for a telephone helpline. Then lactational consult and follow-up also can be planned. So these things, if we do consistently, then the breastfeeding support is established, and mother mostly will breastfeed. Next, please. So a hospital discharge support should be provided, and we should give accurate information for the breastfeeding, whatever we had discussed today. Okay, what are the contraindications to breastfeeding? So HIV, HTLV infection, active tuberculosis, herpes lesions on the mother's breast, infants with inborn error of metabolism and galactosemia, phenylketonuria, mother with certain medications like anti-cancer therapy and radioactive isotope, etc. Basically, any active infection in the mother, herpes on the mother's breast, and any inborn errors and any anti-cancer therapy which harms the baby should these things are only contraindication. Okay. Okay. So these are the resources or various materials for our reference, and we can give these things to the mothers. That these are modern mothers who uses social media like left and right. We can just ask them to read these things, and these are the various groups which provides the information regarding breastfeeding. In this, there is one more group, Facebook group, breastfeeding group of India. So that's another group. It is active on the Facebook. And they encourage Indian mothers to breastfeed. I think that's all. Thank you.
Hello? Hello?
You are audible.
Hello, ma'am?
Yeah, you are audible.
Ma'am, I have one doubt. How much time given the mother milk to the baby? Only in India, 6 months given the breast milk. And after the, what we have to do? Given the cow milk or formula milk? Because you said allergy reaction and allergy disease are coming. Okay. So what we can do?
Breastfeeding should the exclusive breastfeeding for first 6 months means
Yes.
infant cannot be offered anything other than breastfeeding for first 6 months. After that, partial breastfeeding and other food we can give. Actually, there is no need of giving any cow's milk or any outside milk after 6 months. Till 2 years, only mother's milk is enough. After 2 years, if you want, you can give cow's milk. That is more palatable and more digestible.
Okay. So thank you, madam. So I would like to thank you, ma'am, for making excellent presentation and making this seminar interesting and meaningful. So I thank to all students who joined the today webinar here and gain knowledge on breastfeeding and advantages. So finally, thank you to all and then the other departments also, and thank you so much for your cooperation. So once again, thank you, ma'am, and your seminar and your presentation is very wonderful.
Should we conclude here?
Yeah.
Okay, then no?
Hello.
Then no? Can I?
Yeah, done.